I'd like to thank everybody for inviting me. I was here last year, and so it's always nice to be invited back. It means I didn't do anything too terrible. And I've been given a relatively small topic to cover. I just have to, in about 25 minutes, tell you about the health effects of air pollution. And so I thought I'd begin by just giving you a beautiful picture of a cloud, the cloud sitting over the horizon of my city, the City of London, and here I have this lovely cloud of nitrogen dioxide, because I thought that was a kind of good segue into the fact that this entire meeting, and in fact every air quality meeting going on at the present moment in time, is under a bit of a cloud, or rather a shadow. And the shadow, well, I don't think we should duck it, we should just face it head on. The shadow of non-compliance. And okay, I've got VW's badge up here, and those of us who work in the area know that clearly it's not just VW who have emissions in the real world which don't match, if you like, their test cycles. But what I found most interesting about the recent media coverage and discussions of the Volkswagen issue is the fact the story seems to have morphed and changed into a sort of consumer issue, as though the issue here is that some poor individuals have been missold cars. And I think that's a terrible misframing of the issue. And so I want to use my talk to make the case that it's not just the 400,000 consumers of Volkswagen cars in the United Kingdom who have been missold, but every single man, woman, and child within this city, within the United Kingdom, within the European Union in general, because we've been missold a very serious product. Because the product we've been sold is clean air. And this is very serious. Now, I've represented it here as a product, because I always find it really interesting how people view the things they put in their mouth in terms of food and drink very differently from the things that we breathe. And so I think it's actually quite a good mental exercise to think of a can of clean air as being something you might purchase, okay? You're going to buy it for your family, okay? And you're going to probably go and buy the healthiest option, I would have hoped, okay? So you're going to pick a nice can of clean air, and on the label here it says it's got 20.9% oxygen, you know, largely nitrogen, some trace elements of CO2, a bit of methane, some argon and neon, and it may contain water vapor, certainly in the United Kingdom and the west of England, quite a lot of water vapor. But that's our product. But when you pick up a product, many people look at the additives label, and they make their decision based on what the contaminants are within the materials they're purchasing. So we could have just our criterion pollutants. We could have there may be some trace levels of nitrogen dioxide, some ozone, some particulate matter, some volatile organic carbons, and maybe we shouldn't mention formaldehyde because that would put people off the product. And you know, there could be some other organic compounds. But actually, the size of the label would be a little bit bigger than that, because actually we tend to talk about the pollutants in the air in a massively simplistic way. We talk about the mass of particles within the air, and that really is almost medieval. It's useful, but from a health perspective, from a toxicological perspective, it's what the stuff's made of which is important. So let's add a few more things to our label and see how palatable this is, how willing you are to take this off the shelf. Now we've got the nitrogen dioxide, we've got some particles as well, try not to fall over. But now we can throw in some polyaromatic hydrocarbons. We shouldn't put their name down because clearly that would concern people if you knew what they were. There are some quinones, a selection of metals, including some metals which you might have heard of if you read Agatha Christie, like arsenic, cadmium, antimony, for example. Then we've got all these new abbreviations like semi-organic aerosol, primary organic aerosol, a bit of sea salt, that doesn't sound too bad, maybe some resuspended dust. There's a lot of stuff in here. And at the bottom of that label, we might say many of these products cause harm, and some of these products are type 1 carcinogens. That's your product. You were promised clean air, and what you've got is something which is an unlabeled product with contaminants within it. Would you buy it? Would you take it off the shelf? Is that what you thought you were getting? Now, of course, none of that would matter one jot if all of this stuff had no impact on our health. And it would matter no jot that we had problems with compliance with engines if it didn't impact on strategies to mitigate against the population's exposure to air pollution. And so this is really what I think the ramification of the VW scandal and the non-compliance of diesel emissions really is. And I could return to my city. This is London in 2008. This is one of our models of the city. So here we have Greater London, and we're looking at a map which is coloured to show you what the annual level of nitrogen dioxide is within the city. So anything in this map which is yellow, orange, or red is over 40 micrograms per metre cubed. That's over the EU limit value. And you can see that huge swathes of the centre of the city in 2008 are non-compliant with EU limit values. And that represents around 3.5 million people. So clearly, you need to do something about this. And indeed, London was very proactive in schemes and a number of strategies to try to reduce pollution in London to improve public health. And one of the instruments was for the low emission zone, driving, if you like, forcing, encouraging the most polluting vehicles to adopt cleaner technologies. And so my department modelled what would happen if this happened, if the fleet was updated, and this is what was predicted. This is what should have happened in the projections. By 2010, 2011, you can see London's now blue. The levels have gone down. The areas which are non-compliant really are now just the network, a relatively small area in the centre of the city, and you can see that a lot of the area is now compliant. Only that's not what we got. That's the projection. This is what we got. And that map in 2010-11 isn't terribly different from the map in 2008. And that is because the diesel vehicles on whom the whole scheme was predicated did not produce the emissions, the emission benefits they were meant to in the real world. So people who should now be breathing clean air are still breathing polluted air. So it's a public health issue. Car ownership is a tiny fraction of why we should be concerned about that. And we should be concerned about it because air pollution, though it's so nebulous and people still have difficulties wrapping their minds around the fact that something so intangible can have health effects, does have profound health effects. And the next figure I have here is taken from one of the global burden of diseases. Now, I know it's very difficult from the back of the room to see this, but what we have here are 20 leading causes of death in the world for 2010. And at the top you have things like high blood pressure, which you would expect. Number 2 is tobacco smoking. And this is sort of coloured. It tells you what people's dying of. People who die of tobacco smoking are dying of cancers, cardiovascular disease, respiratory disease, and so forth. But number 4 in the list is indoor air pollution. Now that's largely in the developing world through biomass burning. And if you go down, at number 10, we have ambient particulate matter. People are dying of cancer, they're dying of cardiovascular disease prematurely, chronic respiratory diseases, and increased rates of respiratory infection. And when you begin to quantify that, you begin to get a size of the magnitude of the problem. So, how many premature deaths? And to frame this correctly, what this analysis says is globally there's around 3.1 million deaths which are brought forward in part through exposure to ambient air pollution. In the European area, that's 430,000 premature deaths, or over 7 million years of healthy life lost. That's a significant public health issue built upon a very robust evidential base. There's so much evidence and so much literature on the health effects of air pollution, you could almost retire from doing active work and simply review the literature. And in fact, over the last 4 or 5 years, there have been numbers of examples where people have done that. So I've put here a number of reports. The HEI report, which reported on the links between traffic pollution and health. The COMEEP report, published in the United Kingdom. This is the report which came up with the 29,000 premature deaths within the United Kingdom, and that 29,000 in the recent death for consultation document is now up to 60,000 once you begin to put the NO2 premature deaths with the PM2.5 deaths. We have the World Health Organization reviews to the European Union, which made a big case for the fact that the limit values actually were, okay, but there are definitely health effects below what our current limit values are. And there are thousands. Many, many, many pieces of work. But I can summarize some of these in a table which was published by the HEI. Because this, I like the HEI report because this is really robust, take this to a court of law level of, if you like, synthesis of the data. What can we say and be confident when we say it, we can defend? We can say that pollution and traffic-related pollution is definitely associated with all-cause and cardiovascular premature deaths. The evidential base is certainly strong enough for that. It's certainly strong enough to say that it exacerbates asthma, and certainly proximity to traffic is related to new onset and prevalence of asthma, but there are still some questions here. In adults, it's less clear because the evidential base is smaller. And when you look at lung function, there's some evidence here, and this was from 2010, saying that if you live close to traffic, children have smaller lungs. And back in 2010, it was argued that that was suggestive evidence, but it needed some more sort of support. Now, the evidence is strong because there's lots of evidence out there. So let's just talk about the association with PM 2.5 and premature death. This is a classic forest plot, the type of data we generate. Here we have a large number of independent studies, and over here we have the chance of premature death. So if you're on this side of the bar, it means you've got an increased risk of death. So you can see most of the studies are over here. We have one outlier. But the overall estimate is suggesting that for every 10 micrograms per meter cubed increase in PM 2.5, there's a 6% increase in mortality. Now that's very interesting. But what's really hidden in these type of analysis is that many of these studies are quite old. Okay? Many of them are looking at populations from the 80s, the 1990s, maybe into the early 2000s. And that raises some really interesting questions. How relevant is this data to now? Because air pollution has changed, and it's changed dramatically since the dieselization of the European fleet. The mixture of pollutants, the chemicals within the air, has changed. And so, what does that tell us? Well, some people have attempted to now delve deeper into what this PM is and how it affects our health. And I've got two really interesting pieces of data. And again, you'll not be able to see it all at the back, but let me take you through it. This is the same sort of plot as before, and this is looking at, if you like, cardiovascular deaths, and over here we're looking at respiratory deaths, and here we have a list of not particle mass, but chemicals associated with the mass. So at the top we have vanadium, elemental carbon, nickel, and you go all the way down. And you can see if you look at the components, certain components are associated with the health effects. And in both of them, I've put a little bar around elemental carbon. Elemental carbon strongly is associated with cardiovascular deaths and respiratory deaths, and at the top there are some metals also associated with oil combustion: chromium, vanadium, nickel. And that's telling us, actually, not that elemental carbon is toxic. It's telling us about where the source is coming from. It's telling us the toxic component is coming from the tailpipe of diesel vehicles. And this is an American study. And they don't have that many diesels in the American fleet. In Europe, they've been able to do some side-by-side studies where they've looked at, if you like, the risk of premature mortality and hospital admissions. And they've looked at PM 2.5 versus black carbon. Again, a signature. So some of PM 2.5 is black carbon, but not all of it. And when you begin to focus more closely on what's coming from the tailpipe, you see that the effects shift. The effects are larger for the exhaust component than they are for the other components within PM 2.5. And that's important because that's kind of like a smoking gun, saying we know PM 2.5 is bad, but this is telling us there's a particular source within PM 2.5 we should be concerned with. But these are all associations, just correlations, if you like, between X and Y. You need sometimes some causation. And one of the things I do is I put people in boxes and I pump diesel fuel or diesel exhaust into the box to see what it does to them. Now that may sound a little bit barbaric, but actually what we do is we do this in northern Sweden because they have a clean environment, and what we try to do is to reconstitute in this chamber what people breathe in busy urban settings. So we create an urban environment, a diesel urban environment, a roadside environment, and then these individuals breathe it in that chamber. Then we can actually see what's going on in their lung. We can go in We can take tissue samples from the lung by biopsy, and then we can actually look within the tissue to see what is happening in these lungs. Now, if you do that, I've got two little rectangles here, and this is from, let's call him Sven, the medical student from northern Sweden. He's been exposed to air, and he's been exposed to diesel exhaust, and so these are little sections of the surface of one of his airways. And we've stained cells within the tissue which are inflammatory cells. They're called neutrophils. You can see the little brown dots here. They're very few after air, but after diesel, you have a huge increase in neutrophils. And the tissue's inflamed. The tissue is red. The airways are swollen, okay? And this is what goes on when you breathe diesel in the real world. It irritates your airway, it damages your airway. And many of the health effects we talk about in epidemiology are the end product of this occurring day after day over long periods of time, causing cycles of inflammation and repair. We've done many of these studies, and so we can say with certain certainty, breathing diesel causes inflammation. It causes changes in the movement of air through the lungs. It causes injury. It impairs the capacity of your airway to fight infections. That's a really, really important point. And indeed, in certain studies, you can show DNA damage consistent with the carcinogenicity of this material. But the effects aren't just restricted to the lung. You see inflammation in the blood, increased blood viscosity, acceleration of atherosclerosis, impacts on arrhythmias in the heart. So there are cardiac effects, there are pulmonary effects, and they all chime and add support to the associations between pollution and the traffic components of pollution with these health endpoints. Now, when you put somebody in a chamber, of course, you're exposing them once, and you're looking at kind of like an acute response to this exposure. But what happens if you live in it every day? And again, now we're looking back over London, looking towards two boroughs in London where I've worked extensively, Hackney and Tower Hamlets, and a bit in the City of London. What is it like if you grow up there, and so you're exposed recurrently to these high diesel environments all of the time? Well, I showed you a map earlier on, and maps look like areas, and sometimes you forget that they're also where people live. And so this is one of the years, one of the study years, we looked at the lung health in children. Each of those black dots is a child. It's a residential address in central London. And as I told you before, if the map is yellow, it's non-compliant with the EU value for NO2. Every child growing up in that particular year in Tower Hamlets and Hackney lived at a residential address non-compliant. And if we assume from that simple map that where the children live is where the adults live and is reflective of the population, you'd have to conclude that you have about 500,000 people in that picture who live in an area of non-compliant air quality. That's a bit of a shocker, I think. Again, that wouldn't matter if they didn't breathe it, or the actual amount they breathed didn't matter, or it didn't get into their lungs. But you can actually show that they internalize the chemicals and the entities within the air they breathe. So here we have one of the children we examined, and he's breathing into a device which is making a hypertonic saline. It's going to give him a gagging, coughing response, and he's going to cough up a blob of mucus. And in that mucus, you can see cells which would otherwise be within the peripheral airways of the lung. And these cells are called macrophages. I would like to think of them as sort of like they're kind of the refuge collectors of the airways. And if you look at children in London, you can show that they're macrophages, and so this is a macrophage cell. The big black dot is the nucleus. See all these other little black dots? And they are little elemental particles of carbon. Again, they're there. It's not just carbon. All the things which are associated with that carbon core is within that cell. And the greater the exposure of children to air pollution, the more carbon you see within the airways in these cells. And the more carbon within the cells, the less able they are to fight infection. So this really matters. But then there are some other interesting ones. Iron. Iron's like the most abundant metal in ambient PM. And it goes in, and we can't get rid of it, and it doesn't come out. So what's happening to that iron in populations living in urban centres? By definition, it must simply be bioaccumulating. So children are internalizing components of the air that they breathe. And we already know that we should be concerned about that. The first study which illustrated this was published over 10 years ago out of California, the Children's Health Study. And it followed about up to 1,800 children for 8 years and looked at their lung growth longitudinally. And it demonstrated that children who lived in the most polluted areas, the areas with the highest NO2, PM2.5 and elemental carbon, remembering that NO2 and elemental carbon are pretty good signatures of diesel, had smaller lungs. And that the loss of lung function by the age of 18 was somewhere between 80 to 100 mils. That's a clinically significant deficit. And they produced this graph, which is very nice. And what they're looking at here, as I tried not to kill myself, is the change in lung function. Children whose lung function is less than 80% of what it should have been at age, against the PM2.5 level of their community. And each of these dots is one of the various communities they looked at. So you can see, you lose more lung volume, more people have smaller lungs in the more polluted areas. And just living near a road in the follow-up paper is enough to result in smaller lungs. And I like this study because it says if you live nearer than 500 meters from a freeway versus away from a freeway, 1,500 meters, which means a lot in an American study out of California. It means very little in urban European centers where most people in the middle of cities actually all live within 500 meters of a busy road. But then these papers started coming out on the impact of pollution on the brain. And the first one came out about 4 years ago, which simply said that there are higher rates of autism in children who lived near to heavy dieselized roads. In the States again, a low diesel society. And we all thought, well, that's interesting, but it's one study. And then this is going to be a bit like one of those sort of like 1930s black and white things, because then the papers became thick and fast. Papers from all over America, papers from Taiwan, papers from Korea, papers from Mexico City. And not just autism, papers showing that there are learning defects in children, deficits in cognitive function. And this has become really a bit of a new front in our public health understanding of air pollution. We don't know what causes these associations, but these associations seem very robust. There was a study recently which came out of the ESCAPE cohort, which didn't show this association at all. But then the ESCAPE cohort comes from before the dieselization of the European fleet. And so maybe what you're looking at is actually a period change which has happened in air quality. Now, I often feel when I stand at one of these venues that I'm the harbinger of doom. I feel sometimes I should wear black and a top hat or something. Because you'll sit there thinking, well, I'm halfway between doom and gloom, and you can make the decision which one is the best direction to travel. But bizarrely, the Volkswagen thing has made me quite optimistic, because it's raised the profile of the topic, and it's also kind of robbed one of the excuses, one of the armory, part of the armory of not having to do anything from people who don't want to do anything. Because we now know we can't rely purely on technology or believe what companies tell us if we want to improve air quality. And the reasons for optimism is if you do tackle this problem, you can have a really significant positive effect. And I've got 3 illustrations of that. You've all seen pictures where there's air pollution along one axis and something bad happening on another axis, and as the air pollution gets higher, something bad happens and it gets worse. There aren't many figures like these, but these figures are cause for optimism. This is a study taken the American Cancer Study. And so this is 51 communities in the United States, 500,000 people. And here they've looked at the change in PM2.5 between 1980 and 2000. So what you're looking at here is how air pollution has improved over those 20 years. And this is the change in life expectancy. So as air pollution has changed, life expectancy increases after controlling for everything else which could influence that association. So the bigger the change, the bigger the increment, the bigger the drop in air pollution you can achieve, the longer lives, the healthier lives your population are going to live. The more money, actually, you're going to save if you quantify it. Here's another study. Here they're looking at symptoms which affect the quality of your life. Persistent cough, persistent wheeze, and this is from a Swiss cohort. And again, they're looking at the change in PM10 And as pollution goes down over time, if it goes down, these symptoms become less severe. You're improving the quality of life of your population. And let's look at the children lung growth story, because in March of this year, they followed up the Children's Health Study. And although this looks very complicated, the only thing which is really important is to look at this little panel here. Because what we have here is the probability that children will have small lumps, effectively. And this is how small they're going to be. And these are the years they examined in that cohort. The first one is in the 90s through to 2000s, and then recently 2007 and 2011. And you can see fewer children have smaller lungs in California than they did 15 years ago, because the pollution has fallen in California because of the actions of the Californian Air Quality Board and their rigorous policing of emissions. So not only here are you saving lives, you're protecting the potential, future potential and life opportunities of the children growing up in that city if you can make these changes. So that's the cause for optimism. Once you know that some things don't work, once you know what the problems are, this is the prize. If you can reduce air pollution, you do get a health dividend. And that's where I wanted to end, but I thought I shouldn't really end with myself. So I thought, because many of you in this room, as this session goes on and the meeting goes on today, have to deal with the thorny issue of how you try to make this better. I don't have to do that. I just have to tell you that you're not doing enough. And, so I know that's really irritating. But if you're struggling to know what you have to do, it's always reassuring to know that somebody told you what to do 354 years ago, and that advice has not changed one jot, okay? So this is John Evelyn. This is his treatise on air pollution in London from 1661. What did he say? After you've removed all the flowery language, the casual racism of 17th century literature, and the wonky stuff about planting, sweetly selling flowers around London to improve life, he's got some nuggets. If you want to improve air quality, you identify the source of the problem and you use a cleaner fuel. So if you've got a fuel which is a problem, you identify that fuel and you replace it with something else which isn't going to create the problem. This is an interesting one. He said, but you can't change things overnight. But what you should do if you can't change things overnight is you should separate the vulnerable population from the pollution. You should make sure they're not breathing too much of it. You certainly shouldn't, build nurseries, daycare centres, schools and old age people's homes next to the most polluted areas in your cities. He also said that it will cost, but the economic rewards of dealing with it are greater than the initial costs. So there's an economic argument here, which is still valid, difficult to explain because the benefits of dealing with air pollution are long-term and the benefits of not dealing with it are very short-term. He talked about green infrastructure, and I'm sure we'll have conversations about that, but one of the key messages he was saying is if you want to live in an urban environment, you've got to make the urban environment a nice place to live. And then finally, he made the point that there was a moral imperative. We have to do this. Having clean air is a fundamental human right. We should gauge the success of our societies by how we look after the poorest and most vulnerable people, and therefore not dealing with it in terms of his 17th century mindset was completely not acceptable at all. And I'd argue it's still not acceptable today. And that's the end of my presentation. These are all the people who did all those bits of work, and that's me finished. Thank you.
Thank you.
Hello, I'm Liz Batten from Transition Southampton. In a former life, I worked on smoking cessation and closely followed all the work on passive smoking. How would you rate air pollution as it is now and the way in which we should be dealing with it in relation to what we know about the health effects of passive smoking?
I think that the passive smoking argument is a really interesting one, because if I'd put a fully comprehensive list of the chemicals associated with ETS, for example, it's pretty similar. to the list of chemicals. Because, you know, when you do smoking cessation, you hit them with these are the 3,500 toxic chemicals within ETS, and everybody recoils in horror. I just don't yet have my slide with the 3,500 chemical compounds. It's very similar, yes. In a sense, we're just behind the curve in the public understanding of the issue here, and also in the fact that now we're beginning to see sensible action on ETS exposures to children in cars, exams, etc. We kind of need to shift the argument so that we're at that position with air quality. And I think it's kind of interesting because one of the things which we often find is that if you're interested in health and you're interested in traffic-related pollution's impact on health, you're seen as being anti-motorist. Yes, and you know, everybody has to have their personal car and their rights to have their car. But the place where you probably have your highest exposure to traffic-related pollution is inside your car. Yes. So bizarrely, as you drive down a road, if you don't have one of those fancy cars with expensive filters which, you know, allows you to pollute the air for everybody else but to be in a completely pristine bubble yourself, if you're in a normal car like most people own, then your children in the back seat as you drive them to school are getting much more exposure than if you walk them along the road to the school or found another route to go to school. And that's very similar to this kind of smoking in car debate, because you're effectively exposing them in a box to the most polluted air you possibly can in the centre of cities.
So we need a public awareness campaign.
We do, but as you know from the smoking cessation and the history of smoking in general, it takes a long time to shift public perceptions. And you only really begin to get that shift when you actually get political buy-in. Yeah.
Hi, it's Peter Fleming, TRL. Sorry I missed a bit of your, I had to nip out, but in terms of NO2, obviously that's what everybody's concentrating on at the moment. Can we be sure that NO2 itself is causing a health effect, or are we still not sure whether it's an indicator of something else? And is there a danger that we could actually reduce NO2 but still not necessarily get the health benefit?
There's evidence that NO2 on its own has health effects. So for the WHO review, it was quite clear there was a lot of pressure coming from national governments to try to get rid of the NO2 standard because national governments couldn't make it. But actually, since 2005, until that review happened, the evidence base on NO2 had improved dramatically. So there's now evidence which shows the effects of NO2 corrected for PM2.5. And so these calculations which are coming out in the literature now where people are adding PM2.5 and NO2 together come from that sort of analysis. But you still have another point, of course, because it could simply be that PM2.5 isn't the correct surrogate. And actually it is something like black carbon, and black carbon and NO2 near roadsides are so collinear it's impossible to pull them apart. So I think that we have to assume at the moment on a level playing field that NO2 does have an effect, but it's also probably acting as a surrogate for the things which are really truly toxic within that mixture, in addition to itself. So it's more like yes, and then there's something else as well. It's not something we can ignore.
But there's no causal evidence as opposed to correlation evidence.
There is causal evidence. The problem with the causal evidence is lots of people worked on NO2 until about 1985, and then particles became the major topic of conversation. And the NO2 literature, the real toxicological literature, died out. And so that evidence base is quite thin. It's only now beginning to take off because when the review of the NO2 literature was done, it was quite clear that we needed more toxicology and understanding of the underlying mechanisms by which NO2 can bring about these effects, because they're not there because the work hasn't been done, not because there is no mechanism.
Hi there, Jonathan Leake for Sunday Times. A lot of the money for research comes from DEFRA and GLA and bodies which are most likely to be embarrassed by the results. So I wonder if you can say something about the politics of getting funding for research into this area.
For me, it's not such a big problem because my research doesn't really get funded by DEFRA. My research is mostly through the research councils per se. DEFRA, I think, from experience of the people in my group who've worked with them, are pretty good in terms of allowing publication, and they don't quench things. It gets a bit more awkward if you're then dealing, if you've received money from local government, if the message is a bad message, because science does rely on the fact that we have, independence to have a scientific debate, and you can't have people saying, well, we don't think your results mean that because it's not convenient to what our central message is. So I must admit, personally, I can only speak for myself, I've kind of avoided getting money from, if you like, industry, government sources, and focused on research councils, because then there's no debate, yes. You're doing the work for the general public. Nobody can think that you're doing the work for them and think they have some sort of oversight and control of the message you want to create.
Hi there, it's Stephen Thompson from Transport Scotland. It's a two-part question. All the data that you presented there, has anyone ever asked you to transpose that into a communication strategy for the general public? And if they were to do that, what would that campaign look like, given that you've got a nice big blue poster to your left-hand side? What would it look like over a 3-year period?
Do you know, there becomes a point, yes, that you have to know your limitations. Okay, and if you really want to communicate something to the public and you want it to be done well, framed well and be successful, you go and speak to the professional people who know how to do that. Scientists are much more visible now, the people in this film, than they've ever been, yes? They go and speak at venues and we do things like that, but we still are amateurs, and we need people to come and help us to take the message and promote it. And I think we kind of need the people who do this best to do it. We need the advertising community to come on board to help us hone our messages so that they actually do connect with the general public.